children going uninsured, unable to access health insurance, using the emergency room as their primary care physician is not what we want for our children in Santa Clara County.
We have families who have had some children born here in the United States and some children not, and no family wants to have to decide to enroll one child in a health program and another, and up until Children's Health Initiative, that was their choice.
The idea of CHI is that we reach out to all children and say, whatever your situation, if you live in our case, Santa Clara County, are at or below 300% of poverty in terms of parental income, and don't have employer-paid insurance, come to this event, come to this enrollment event, come to this CAA, Application Assister, and we will help that child get the appropriate coverage.
Well, it really had a genesis from activities from two organizations. One, my organization, Working Partnerships. We were actually engaged in a broad effort to try and think up new public policy ideas in several areas, and we had roundtable discussions with people who had expertise or information about these areas, and one of them was healthcare. And at that meeting, a very large number of the participants said, what we really need to do is find a way to provide everyone with health insurance.
I think the reason why we had a lot of support for the idea of Children's Healthcare Initiative was everybody really understood that you have to provide kids with health care, or there's going to be serious problems in the education system, in the healthcare system, and in their lives in the future. So it was a wise investment to invest in healthcare for kids.
The way we got involved was really dreaming about what was possible for our community, looking at the type of families that were in need, and knowing that the need was really great in our community, and we needed to do something to address the issue around health care.
When a group of community members came to us in 2000 with a bold and innovative and exciting new idea for solving the problem of uninsured children here in our own local community, right in our backyard, we were very excited. Here was a new approach to a problem that we had been dealing with and working on for the past several years, and the energy and enthusiasm that was brought by this group of community members was inspiring. We didn't know yet if it would work, we didn't know what would happen, but we knew that they had a significant investment of already public dollars and also of the inspiration of the people that was behind them.
Once the idea was hatched, the group of people that had the idea kept working on the idea, and it's sort of like a seed that's been germinated and it just sprouted and grew, and the roots in the plant of the idea of the Children's Health Initiative just kept growing. And as people learned about the idea, they became interested, and that interest just kept escalating. And we've got the Board of Supervisors involved, we've got the City Council involved, we've got the health and hospital system involved, and Working Partnerships and PACT really sat down with the health and hospital system, and we took the idea and really put legs on it and fleshed out the idea and thought of ways to implement it and make it all come together and work. We kept pulling together the right people in growing the group in order to grow the idea.
So my job, frankly, was a lot easier than other people's. I just made sure that the process kept going and that we met our time frames. I made the decision early on that we wouldn't cross all our T's and dot all our I's. There's no such thing as perfect, and we're not going to sacrifice good in the search of perfection. Many of these programs don't get started because a lot of answers to questions don't get answered because they're not answerable, and then people have to make judgment calls. And I put a lot of that to the side and said, look, that's minutia given the goal here.
Challenges be damned, in effect. We didn't deal with challenges. What we dealt with was getting it done. If you start focusing on the challenges, I think you lose. You lose very much.
One of the key things that social services did was that we were really open to changing our processes, looking both internally and externally to see what we could do for families who came directly to us to ask for help, as well as helping the community understand our process and help families navigate through that system.
One of the Foundation's investments in the Children's Health Initiative has been to sponsor an evaluation that's been done by Mathematica Policy Research. That evaluation has shown that the Children's Health Initiative works. It works to improve children's access to health care. It works to improve children's access to dental care. It works to improve their health, and it works to help them to be in school more.
The results have simply been phenomenal. First, thousands of children have been insured by the new product we created, Healthy Kids. Secondly, because we had the new product and we were able to market it with the theme that all children should have health insurance, we were able to substantially increase the number of children who enrolled in the existing health insurance programs for kids, Healthy Families and Medi-Cal. And now that the program's been in place for several years, there's been very objective scientific studies that have been done about the effects of the program, and those have been excellent across the board.
Since the creation of the Children's Health Initiative and the CHI launch in 2001, over 139,000 children have been assisted in applying for health insurance. That's Medi-Cal, Healthy Families, and Healthy Kids. And at one point we had over 13,500 children enrolled in our Healthy Kids program.
The research data is absolutely clear and had been for a long time. School attendance improves, grades improve, general health status improves. There are no downsides to this kind of a program from a societal perspective.
Healthy kids means good education, staying in school. It makes a lot of sense and it's a wise investment. There is no doubt this was one of the best investments made by Santa Clara County, and it's really paid off.
There is nothing more exciting to me than when I will be traveling across the United States representing Santa Clara Valley Health and Hospital System and someone will say, "Aren't you from the Children's Health Initiative?" Or when a doctor in the system says, "I am so proud because Children's Health Initiative is on the map." So it's been exciting, and what an amazing experience to be involved with so many people who have at their heart what's right for kids and families here.
We all have something very proud to be, something that we all should be very proud of here in this county, that the will of the people speaks truth to power. Children are better off because of commitment and vision. It is better for all children.
It was an exciting time, and there was so much energy around it that people could see that we were going to move forward and succeed. And it was, I think, just the right thing to do for families and children.
The important piece and the most important piece of our health insurance is that we all came together. All of our organizations were willing to put a stake in the ground and ensure that children and their health was a high priority for our community.
We have wonderful people in Santa Clara County, very full of initiative, full of energy, full of creativity, and very, very progressive. And because of that, we were able to get this program going. And we're very proud to be the first to be able to do it.
Today, there are 25 Children's Health Initiatives that have followed in the footsteps of Santa Clara County in 30 counties across the state. This community should be proud of the Children's Health Initiative.